Thank you for your time and attention. My name is Dr. Michael McPherson. I am the founder of clinicalbfr.com, and I am a BFR specialist with Airbands BFR. It is a great pleasure to share this systematic review and meta-analysis with you. It was published in June of 2024 by Day K. Ruse et al., and it is titled Hypertrophic Effects of Low Load Blood Flow Restriction Training with Different Repetition Schemes. It is a systematic review and meta-analysis of 23 randomized controlled trials with over 495 participants. Systematic review and meta-analysis analyze the effect of low load, low intensity blood flow restriction training versus high load, high intensity resistance training on hypertrophy, focusing on the repetition scheme that was adopted. They compared the 75 rep protocol, 30, 15, 15, 15, traditionally used in blood flow restriction training, versus multiple sets of 15, anywhere from 2 to 4 sets of 15 repetitions. The question that started this investigation was, does low load blood flow restriction training produce hypertrophy similar to high load traditional resistance training, and does the repetition scheme matter? Low load, low intensity blood flow restriction produces increases in muscle size and strength similar, no statistically significant difference, to high intensity heavy load resistance training, regardless of the repetition scheme that is employed. BFR can be adapted to the patient. Who are you working with? Older adults, athletes, sports performance. BFR can meet the patient where they are. The traditional 75 rep scheme is very helpful, but lower volume protocols, like multiple sets of 15, are going to be more tolerable. They're going to be more clinically realistic. It's much easier to get someone to do multiple sets of 15 versus 75 reps, and they're still going to be just as effective. It's important to know that the muscle environment that triggers muscle hypertrophy is a hypoxic, mechanically and metabolically stressful environment. That is what we're trying to create in the muscle with BFR. It is not exercise with the highest pressure possible or perform as many reps as possible. The goal is to create a hypoxic, mechanically and metabolically stressful environment, and those things are going to drive, it is that environment that drives muscle hypertrophy, increases in muscle protein synthesis, increasing heat shock proteins, hypoxia-inducible factors, and all of the anabolic benefits that accompany a hypoxic, metabolically, and mechanically stressful environment. It's hypothesized a ceiling effect with blood flow restriction. And basically what that means is that once a certain level of fatigue is hit, there's no longer going to be a continued increase in the anabolic response. We've maxed it out. But what we will continue to do is increase muscle damage, which could have a detrimental effect. A side analysis of the study found no difference in terms of muscle hypertrophy between 75 reps and 150 reps. And it is my professional hypothesis that the sheer number of repetitions patients have done in the past has been responsible for a lot of the delayed onset muscle soreness, the DOMS, that patients have felt with blood flow restriction training. Practices, key takeaways for applying this in the clinic. We want to make sure we're measuring an individualized limb occlusion pressure, because arbitrary pressures are going to produce different levels of occlusion in different people. The 3 biggest factors when it comes to determining a limb occlusion pressure, or the minimum pressure needed to occlude blood flow, are limb circumference, muscle mass, and vascular structures. So that is why it's very important to have a device that automatically calculates that limb occlusion pressure for us. We want to perform 2 to 3 BFR sessions per week for at least 4 weeks, and we should have hypertrophy. 1 to 3 exercises, 3 sets of 15 repetitions, 30 to 60 seconds rest between each set, remain inflated during that interset rest, and then 1 to 2 minutes rest after each exercise, and at that point, we can deflate the cuffs. The same level of hypertrophy with low load, low intensity blood flow restriction as we would with high intensity, heavy load resistance training. And we can do that with multiple sets of 15 instead of the 75 rep protocol, which means BFR is going to be more adaptable to our different patients, our older adults, our deconditioned, early post-op, and we can continue to progress and grow with the patient so that they get the proper physiological stimulus they need in order to increase their muscle size, strength, and live a more independent and fulfilling life. Thanks again for having me. My name is Dr. Mike McPherson. I'm the founder of clinicalbfr.com, BFR specialist at Airbands BFR. You can find me on LinkedIn, Instagram, and then also be reached at clinicalbfr@gmail.com and at michael@saga, S-A-G-A, .fitness. Thank you. It was a pleasure.